Everyone, welcome back to our channel. So today's topic will be one of the most common injuries what you have all have faced once or other in your lifetime, that is adductor tendinitis, also known as adductor tendinopathy. Sounds a bit confusing, is it? The simpler name, groin pain, simple groin pain. So what is this adductor tendinitis or this groin pain? Mainly our inner thigh muscles, the tendons or the muscles connecting towards our inner thigh, that tendons getting inflamed either due to overuse, overstretching or regular activity, which causes the inflammation and causes the pain. These are the muscles that helps us bring our legs closer towards each other, and this injury which are commonly seen in athletes, which they of course overuse by running, jumping and stretching before without proper warm up. These are the people who are most commonly affected. So what are the symptoms? How can this adductor tendinitis be affected in one's body? So mainly any sharp or like shooting pain over the groin area, which goes up or down or at the localized area itself. Then next is the soreness or any bruising over the inner thigh. Third is the pain coming when doing walking, lifting up or while giving a quick stretch over that particular area, causing the pain from the inner side of the thigh. So, causes. What causes this adductor tendinitis? So, basically, first what I have told is overuse. Whatever activity you are doing, if you are doing it for a prolonged time, stresses that particular muscle group and then causes damage. Next is any direct trauma or injury to that area. Suppose you get hit by that or you fell on your outstretched leg, causing too much overstretching over your leg, causing the adductor tendons to get inflamed. Third is the muscle imbalances or the muscle weakness around the hip joint. So not only the adductor muscles, if your abductors are also weak, that may cause an imbalance in the inside part of the thigh, causing the groin pain. So next is diagnosis. How can we find out if whether this is a adductor tendinitis or something worse? So first and foremost, you have to go to a professional physical therapist or a doctor which can assess your hip area, basically the inner thigh. So clinical examinations, they'll check for any bruising, any inflammation over the affected area. They'll check the range of motion and they'll check the power of the muscle where you are able to lift and bring together your muscles. Second will be if these clinical examinations, if the doctors are not able to find out, they'll obviously recommend you to go for a scan, which is your CT, your X-ray or an MRI, to rule out if there is any wear and tear of the muscles of the tendons that is occurred there. Next, going towards the treatment protocol. What all you can do to prevent. Not only prevent, how to cure the adductor tendinitis. So that will be first and foremost will be rest. Try to take few days of rest and to minimize the activities what all are you are doing. Second will be if the bruising or the inflammation is there at that particular area, try icing it in order to reduce the pain and inflammation. If these two are not at all working by your side, better go to a physical therapist, let them assess you and let them conclude that this is that particular problem itself, and then thereby they'll give you a specific exercise protocol that you need to follow, which will be at the end of the video. I will personally show you what all you have to do for strengthening the adductor muscles. Preventive measures. How can we prevent, how can one prevent in getting this adductor tendinitis? So basically the first and foremost, warm up properly before any sort of exercises what you are doing. Proper warm up can lead to proper blood flow that can reduce the risk of injury in any muscle group. Next one, proper flexibility and proper form in whatever you are doing so that you can avoid while doing any stretches, any kind of strengthening, so that you can prevent the injury. Third will be the whatever stretches and strength training you are doing, make sure that you won't go to a load which is more heavy for you, so that the leg can bear the amount of weight and can improve the function of the muscles in order to grow. So once you are sure that adductor tendinitis or any groin pain has occurred to you, always remember strengthening is better than stretching, so that you are not overusing and you are not overstretching the affected part. So once the pain level is reduced to 2, 3 in the pain scale of 1 to 10, these exercises what I'm about to show you will definitely help you. So first and foremost, take a ball of any size, basically a medium size will be fine. Keep it between your legs. You can lie down if you want, or like sit up according to your wish, and lift up and squeeze and hold for 5 seconds and relax. You can do this for 3 to 5 reps 10 times each. Next, same as that, keep the ball at the knee area. You can lie down, and then same like the leg part, you can squeeze the ball, hold for 5 to 10 seconds. Same like that, 3 to 5 reps and 10 times each. Next, other exercises including same squeezing on the knee area. Only difference, you have to lift the leg up and then try to squeeze so that you may feel pressure over your inner thigh. Same as that, 3 to 5 reps 10 times each. Next, to little bit more strengthening of the adductor muscles, you can use a TheraBand. Loop it under your leg like this, hold it with your hands, and then start lifting up so that your inner and outer both will get engaged. Hold for 5 seconds and relax. Do it for 3 to 5 reps 10 times each. If 3 to 5 reps is more for you, start slowly. 1 rep 10 times each also can. For the advanced improvement of the strengthening of the adductor muscles, take a chair or a table which is there of minimum height. Make sure your right leg or the affected leg is on top, like with bent part, and your left leg or the unaffected part needs to be in a straight manner. Your left elbow or whatever elbow, depending on your leg, keep it bent so that you can load on it. Make sure you are doing on a mat. The next is what you have to do. You have to thrust up, lift your leg, and then lift your hand as well. Hold it for 5 seconds and relax. Do this for 5 times, how much ever you can. Make sure that you do not injure yourself. So I hope this video was beneficial for you, for all the growing pain you and your family might have faced before without having any answer. So, but if make sure you go to a physical therapist or a clinician to rule out any other symptoms if you are having the pain, and if the pain is not coming down even after doing all of this, make sure you do not injure yourself. So follow for more, subscribe to our channel for having more of the videos for how to strengthen, how to get stretched properly, how to do exercises properly, and witness your fitness with us.